Good afternoon, Dr. Meyer. I'm pleased to meet you. How are you today?
I'm good. How are you doing?
I'm doing good.
Good.
I'm so excited to meet with you today to discuss about the lack of dental care for kids. Before we begin, could you please tell us a little about yourself?
Sure. I'm Carissa Meyer. I'm a private practice pediatrician. I've been practicing for about 20 years, and I have 3 daughters also.
Thank you. To get things started, could you please share your thoughts about the importance of dental hygiene in kids?
Yes, dental hygiene is so important, and one reason is because I've just seen when it hasn't happened. I've had multiple patients, unfortunately, in my practice who have needed dental surgery because they've had, more severe cavities and they typically can't sit still to get the cavities fixed in the dental office. So instead, they end up having to have surgery and have general anesthesia to fix their teeth, and that can just be really scary for the child and for the parent, and very expensive too. And it's just made me think, if only we could have, prevented it, that would have been so much better, for them.
Thank you. As you know, I'm a Girl Scout, and right now I'm working towards completing my Gold Award project. For that, I want to raise the awareness of kids about good dental habits and how that will benefit their overall health. From my research, I found that cavities are the main issue for bad hygiene for kids. Could you explain what causes them and how to prevent them?
Sure. So a cavity is kind of just like what it sounds. It's like a hole in the tooth, and it's made by an acid that is dissolving the enamel. And usually there's also bacteria in the mouth that are leading to cavities, and then also foods that you eat, foods that are more sugary or sticky. And then finally, a lack of dental hygiene and not caring for the teeth makes them worse. And then preventing them is very simple. A lot of times it's just brushing, twice a day for 2 minutes, flossing between any teeth that touch each other, and then good dental care going to the dentist, and then also using fluoride. So that's why we add fluoride to toothpaste because it can help prevent cavities, and we also have fluoride in our drinking water too.
Thank you. Some people tend to think that cavity formation on baby teeth is not as important or serious because they will fall out either way. What would you tell those people?
Well, I would say that it is true they are going to fall out eventually, but most baby teeth don't even start falling out till they are 5 to 6 years of age. And then a lot of the molars, the bigger teeth that babies get, can stay in your mouth till you're in middle school. And so that's a long time to have an infected tooth in your mouth. And basically, when you have a cavity, it's kind of like just walking around, with a chronic, constant infection. And not only is it just, a cavity, it can turn into an abscess, which is a more severe infection of the mouth. And then it can also, from that, even spread, to the blood and cause an infection in the blood. It can even spread to the brain. And there's been, some cases sometimes where it just gets that severe. So.
Similarly, from what I've researched, untreated baby teeth can progress to become bigger and eventually spread to the gums as well, so they need to have root canals and crowns. Yeah. Overall, this just causes a lot of pain for them, and it's really costly as well. So kids should be forming good habits to prevent costly surgeries. How do you get your patients to incorporate good dental hygiene?
Well, I think I try to talk about it at every visit, once the teeth are erupting. And so we try to remind them to, first of all, just start brushing the teeth. We talk about the right foods to eat, to avoid drinking juice, and avoid sipping milk throughout the day, to try to, wean off of feeds. When babies keep drinking bottles in the middle of the night too long after the teeth come, that can cause cavities too. And then also trying to encourage them to find a dentist, and then use fluoride toothpaste eventually too.
Those are some great solutions. Also, sometimes people, not just in our community, but in rural places, won't have access to dental checkups or even dental materials. Do you have any suggestions on how the community can help those people?
I still think, I think the basics of, dental care and dental hygiene are just pretty simple, like a toothbrush, toothpaste and floss, and those are usually pretty inexpensive, items. So I feel like if we can make those more available, and just be sure that parents know that we want to brush the teeth as soon as they come. And then I think, kids always love toothbrushes. They're fun colors. They sometimes have like little timers you can use to help brush your teeth. I think all those things can make a kid more excited, and they maybe would want to do it too. But it's really the parent. The parent always needs to brush and help the child. Yeah.
Definitely, and I hope one day every child in this world will be able to get the proper care and create good dental habits.
Absolutely.
Is there anything else you would like to add?
Well, I just think you've definitely inspired me by coming today, and I've thought more about like what we could do in our office. And the American Academy of Pediatrics, they actually do recommend that if a child doesn't have a dentist, that at the pediatrician office they can apply a fluoride varnish when they come for their checkups. And so I've really thought more seriously that to see if we can do that at our office too, to try to do our part to prevent cavities. So.
Thank you so much for your time, and I got to know more about bringing awareness for dental care in kids. This was a very informative interview, and I know many people thought so as well. Thank you for giving your time today to explain and help bringing awareness about dental care for kids.
You're welcome. Thanks for coming too.
Thank you.